Well, thank you very much, Gail. What Gail did not say is that I've known her since she was, I don't want to embarrass her, but I've known her since she was a very, very young child even. Because Gail's mother and I worked together in Goa for 20 years. And now we both live in Delhi. You might wonder why anyone from Goa would ever want to come and live in Delhi. But I think it's because Delhi is a very exciting place. I'm really excited to be in a room full of young people because that's really the focus of my talk. And what I know that all of you are law students. And what I'm going to try and do is to talk to you about something. It's not a very happy topic at 5 in the evening. It's actually quite a grim topic. But I think it's a topic which is at the heart of young people's well-being in our country today. And it is reflected in perhaps the saddest statistic of all, which is the subject of my talk. But I would like to say, to complete my story about Gail in New Delhi, is that Gail's mother and I have spent a lot of time working with young people. We now work in Bihar, and she works in Jharkhand and Chhattisgarh and places like that. But we started off our work in Goa. And some of you wonder why I enjoy being in Delhi. It's because much of the work that we did in Goa was always discarded as being completely unimportant because, who cares about Goa? It's only a place to go to the beach and swim and get drunk. And also anything you do in Goa doesn't really reflect the rest of India. And so we felt it was important to begin to research this particular subject of young people's well-being in other parts of the country. So that's why I work now with the Public Health Foundation of India here in Gurgaon. I also found Delhi is a great place for two other reasons. First of all, it's where the ministries of education, the ministries of health are located, and where a lot of important policies are made. So I've had a very good fortune of serving on a number of Government of India committees, including the new National Adolescent Health Program, Technical Advisory Group. It's also an incredibly young city. When I take the metro every day from South Delhi to Gurgaon, I'm amazed by the diversity of youth from all over our country who have made Delhi their home. And this is not the case in Goa. Goa is still very much a small, for those of you who go as tourists, you might think Goa is cosmopolitan. It's not, I'm sure Gail will tell you. It's an incredibly conservative and a small town place where every village will distinguish itself from the next village, and within the village, every community will distinguish itself from the next community. And sadly, it is also a place where these age-old divisions continue to exact a terrible toll on the lives of young people, which is why you see many young people, when they can, will escape from Goa as soon as they have cleared school. But that's another story. My story today, as I said, is a grim story, and I want to start that grim story by the very first slide, which will tell you a little bit about what the topic is about, which is about the seeming loss of hope of young people in our country today. I'm just going to take a snapshot of a number of recent news stories that have hit our headlines. You will remember some of them much more vividly than others. There are actually thousands of these stories, but these are just a collection, a sample of stories just from last year. So this particular story you will remember, some of you will remember, 4 young female athletes in a sports training facility in Kerala were sexually harassed by their older sports students, as well as in one particular case a tutor, and attempted to kill themselves, of whom one of those young women died. You will, of course, have certainly heard, I don't know whether Kota has a law entrance exam thing, but it certainly has an engineering and a medical entrance exam. It's like a tuition factory. Actually, this news story is interesting because whereas 5 suicides happened in 1 month, this was the month of December last year, actually in the year 2015, at least 24 suicides were reported to have happened by students in Kota. And in fact, there's a whole ongoing investigation to figure out what is going on in this town, not far from here, which has become a tuition warehouse, and where young people go with hopes and dreams, which are often crushed and lead to suicide. Then, of course, this is the most famous sensationalist case, the death of Rohit Vemula in Hyderabad, which has also spun an enormous political there's been an incredible political slugfest on television and the newspapers, people blaming each other. Is it caste-based? Is it the university that was not sensitive? Yet actually Rohit Vemula's own story, the note that he left, I think captures some of the saddest account of really what he was going through for months before he ended his life. Somehow that note, of course, has been completely obscured from view as people have argued with each other on the airwaves. This was an interesting one because, again, in this case it was to do with education. This was when medical students in a alternative medicine, a naturopathy kind of medical college in Tamil Nadu ended their lives because they were so fed up that this medical college that took a huge capitation fee, that had charged enormous amounts of money, and their parents had to borrow money to actually pay the fees, actually had no facilities, no teacher, no rooms. But perhaps most terribly for these young people, the medical inspectors that were sent by the university to certify these colleges actually would give them full marks. So that year after year, this college with no teachers, no labs, no nothing, would still get its accreditation from the Medical Council of Tamil Nadu. It was obvious how they were getting the accreditation, and you could imagine the frustration of these young people in this medical college, and what finally drove 3 of them to kill themselves. And finally, and there are many more, but this was a particularly poignant example of Saira Sirohi, a young national champion swimmer from Ghaziabad, who was found hanging. Actually, I did some research into her story, and we never figured out exactly why this bright and bubbly 16-year-old athlete, and medal-winning athlete, ultimately chose to end her life at this very young age. Now, all of these stories are very interesting in the sense that each one of them has been dissected by the media and, of course, by the political class and all the crazies on television news who act, in a way that each of them is a separate, completely independent story. Each one has its own story in which you have to attack somebody. You have to attack either a political party, you have to attack a head of a university, you have to attack some grouping or the other. But there's been a very important common thread that runs through all of these stories, and thousands of more such stories in India every year. And this is the thread. These are young people in the prime of their life. These are not young people who are living on the streets, who had no opportunity for education. These are young people actually often in some of the best institutions of India. These are young people who have been able to break away from tremendous disadvantages. Many of them have come from very humble backgrounds. But unlike their parents, have been able to break away from those disadvantages to experience a freedom that young people in India can potentially experience that their own parents did not. These are young people from all over the country. They are often in cosmopolitan urban settings. This is not the neglected, deprived population of Bihar or rural Bihar or Jharkhand we're talking about. It's people like you who have actually chosen to end their lives. And I think that really struck me as a very sad commentary on what success in youth actually means for many young people in our country today. And I would like to continue this narrative this evening by suggesting to you that the success that we hope for in our lives is often battered by the reality of the social environment that we find ourselves in that leads to loss of hope. But I'll come back to that in a moment. Let me first tell you a little bit about how serious the issue of suicide in India is. Some of you will have read some of my work, both the scientific work but also the stuff that I write in the newspapers. But essentially, just to summarize it, just last week, the Lancet Medical Journal, in my business, I'm a public health researcher. The Lancet is the best medical journal that we have. And we've just published a paper last week that looked at really what are the leading causes of death and disability for young people, that is really around the ages of 10 to 24 in all countries of the world. But this particular Lancet paper really was primarily focused on the global picture, but I also had access to the actual numbers from India. That number is about 60,000. 60,000 young Indians will have killed themselves last year. This is, of course, according to the government data. However, some years ago, I collaborated with the Registrar General of India to actually do something quite different. Do you know how suicide is reported? You're a law student, so I'm going to ask you, how do you think a suicide is counted in our country? The NCRB, what does the NCRB stand for? You should definitely know that. Yeah, the National Crime Research Bureau. So where does the NCRB get information that enables it to count up the number of suicides, accidents, and homicides in India? Yeah, from the police station. Now we all know how the police station works. And essentially, when someone dies in a mysterious or unexplained way, they will have to have some kind of panchanama. They will have to have some kind of a coroner inquiry. Now, do you know what the consequences of suicide in India are? If somebody dies and the cause of death is a suicide, what is the next step legally? What is the status of suicide legally in India? It's still a punishable offense. So it's of course one of the thousands of meaningless, stupid laws that we inherited from the British that we have still to throw out of the balcony. So imagine a situation where someone in your family has committed suicide. Usually it's due to poisoning, which is obviously could be accidental. You go to a police station. The last thing you want is to now be charged on top of the grief that you're experiencing with a criminal offense of abetment. Because that is usually what happens. The police will then cart the whole family off, charge them with abetment, will look for potential harassment issues, etc., etc. So the easy way to deal with this is to, of course, slip a little bribe, and it becomes an accidental poisoning. So it isn't surprising that this number of 60,000 is an underestimate, but we wanted to really look at how much of an underestimate. So we did a study in which we looked at the numbers of suicide not by looking at the police statistics, but within a large national study looking at why Indians die. That is to say, with every death that happened in 1 million randomly selected households in the country, enumerators and surveyors would go to these households every 3 months to find out every birth and death. And for every death, they would do something called a verbal autopsy. This is a documentation from the family of the person who has died, of the circumstances of their death, which could be a medical or an accidental or injury death. And then those verbal autopsies are rated by 2 physicians who then say this death was because of TB, or this death was because of malaria, or this death was because of a suicide. And we found that the actual number of deaths is almost 50% more, especially in young people. This underreporting was the greatest. Does anyone know why? We've looked at reasons why this is. First of all, let me ask you, in which gender do you think was the underreporting greater, in young men or young women? That is to say, misclassification of suicide as an accident. Was it be affecting young men or young women more, do you think, in our country? Young women, yes, absolutely. And why would that be the reason? There is a legal reason for that. Exactly, yeah. It's to do with the law that currently states that if a young woman within 7 years of marriage commits suicide, then the suspicion is cast on her husband's family for having harassed her, and of course dowry is the key reason. It is for them to prove their innocence. It is a very peculiar situation where you are guilty until you're proven innocent. And so obviously there is a much greater incentive to mark such deaths as being due to accidents. So this systematically undercounts the number of suicides. Now the other important thing I wanted to draw from that study was the difference between suicide rates in India and other countries. Because it could well be that our suicide rates are pretty similar to those in other countries. So I'm sorry if those of you don't like to see charts, but there are only 2 of them. In this chart, what I've done is I've shown you the age standardized, that is age adjusted suicide rates for India, which is the blue line, and for high income countries. These are Europe, North America, Australia, and New Zealand. And in the x-axis, this axis here, you can see the age band. So this is 15 to 19, 20 to 24, etc. So we're really concerned with this section of the distribution. And what I want to show you first, that for young men, the difference in suicide rates in India and in the developed part of the world is about twofold. So the suicide rate in young Indian men is 2 times higher than in young men in Europe or North America. What do you think the difference is for young women Indian young women compared to women, say, in Britain or Canada? Any guesses? This is a twofold difference. It's a six-fold difference. This is the line for Canada, US, etc. And this is the peak that we see in India. India is one of the few countries in the world where the youth female suicide rate is actually greater than the male suicide rate. In most parts of the world, actually the male suicide rate is higher than the female suicide rate right across the age spectrum. But in India, we have this incredible suicide peak in young women, aged between 20 to 24, where actually the rate is even higher than young men, apart from the fact that it's 6 times higher than any developed country in the world. So this is a staggering difference. It's not just the large numbers. India is a big country with a big population, so 60,000 or a lakh may not be so big from a proportional point of view, but this is now a proportionate point of view, and you can see at a proportion to the population, India's suicide rate for young people is extremely high, and particularly so for its young women. Another very peculiar story about India's suicide rate is that we're traditionally, when we look at social development in India, we're traditionally used to seeing these northern Bimaru states as having the worst indicators, Bihar, Jharkhand, etc. But suicide bucks the trend. The rates of suicide are the highest in the urban areas of India, and they're the highest in the most socially advanced states of India. So as you go down the south of the country, the social indicators on gender empowerment, so-called gender empowerment, I'll return to that point a little later, in terms of employment, of education attainment, all of these increase dramatically. All other health issues seem to improve, but suicide rates keep rising. And they actually reach a peak in Tamil Nadu, which has a suicide rate 10 times higher than that of Bihar. It is the only health condition or health-related outcome that actually goes in the opposite direction to social development. That is to say, in the more socially developed states, the worse is the rate of suicide. The other interesting thing is, even if you remove this state-level comparison, look at individuals, suicide is commoner in the more educated youth of our country. And this is also a peculiar thing, because this is not the same pattern as in the West. In the West, suicide is commoner in poorer and socially disadvantaged populations and amongst less educated people. In India, it's exactly the opposite. It's the successful youth in whom, successful if you count success in terms of educational attainment, in whom suicide is more common. So this is a very perplexing story. It's a story that apparently does not have any parallel in most other parts of the world. And I've spent quite a bit of time trying to unpack, what is the mystery behind this? Why does India have this, first of all, this incredible finding that suicide is the #1 cause of death in Indians aged between 15 and 24 today? Why is it that young Indian female suicide rates are the highest on our planet? Why is it that it is the better off young people in the better off states of India who are actually killing themselves? This doesn't all add up in terms of what we know about suicide in the global picture. So let's first look at what might be the possible factors. First of all, it's young people. Now, I'm sure you all have been accused at some point in your life, maybe even right now. You get accused by your parents, but certainly not right now. At some very recent stage in your life, you've been told, you're passionate, you're irascible, you're very impulsive. And this might be seen as a part of our current generation, the world we live in now. Except that this was actually written several thousands of years ago by Aristotle. And the reason I put this up is the fact that the young brain, the brain of someone aged between 15 and 24, is an incredibly dynamic structure. It is undergoing dramatic changes, and this is a knowledge that we've only had in the last 10 or 15 years. And this knowledge makes us understand now why young people aren't just horribly mischievous and naughty and impulsive and do not listen to us because they're just the way they are. It's because actually there is an evolutionary reason for that. That evolutionary reason is now well understood, and this might sound completely off the wall, but you should listen to this for a moment, because I'll be returning to some more meaningful stuff here. If you imagine this is the brain, we always thought that the brain matures, the entire brain matures more or less at the same time. So that is to say, this part of the brain, which is marked in red, or the limbic system, and this part of the brain, which is the front part of the brain, which is concerned with decision making, with judgment, a higher order cortical function that many of you as lawyers will take so much time to actually be thinking about, that all of these parts of the brain actually mature at the same time. Actually, we now know that's not the case. We now know that this part of the brain, the midbrain, the limbic system, matures actually about 5 years on average before the prefrontal cortex, this part of the brain. Now, why is that important? That's important, and the maturation takes place at the front of the brain around the age of 23, 24. So there's this phase of life between the ages of 15 or 16 and 23 and 24 that the limbic system, the midbrain, is already fully raring to go, but the frontal cortex isn't ready. And the frontal cortex, we now know, is that higher order section of the brain that is involved with decision making, evaluating the pros and cons of your action. You know, there's another interesting parallel to this, the whole issue of the juvenile rape. I'm sure all of you will remember the issue of capacity. Were you able to tell right or wrong? And this, of course, also created a huge discourse in our media. And some of you may have noticed there was also a very sensitive discussion from child development experts saying at the age of 15 or 16, you're not developmentally ready to actually be able to tell right from wrong. You're much more likely to act on impulse without thinking of their consequences. This is absolutely correct, because the limbic system is where your base human emotions are experienced. Joy, fear, rage, excitement. And because you do not have this kind of braking influence that you do at the age of 30, you often act out of impulse driven by these base emotions. So, that, we come back to the issue of suicide. What does this all mean? What this means is that young people are biologically and evolutionarily primed to behave in an impulsive and risk-taking way. And this, of course, is a great advantage for any of you who saw, remember Lion King? And do you remember the little cub, Simba? Do you remember what happens in that movie? There's a very important scene in which he pisses off his father. Do you remember why? Does anyone remember why Simba cheesed off his dad?
He goes to the forbidden area.
Exactly, he goes into the forbidden area. Disney understood young people's brains much before neuroscientists did. In fact, you will see the same story in every film involving a juvenile character with his or her parent. Finding Nemo is another good example. What did Nemo do? He decided to venture up towards the surface of the sea, even though his parents told him there are boats out there that will catch you. But he couldn't resist the thrill of breaking the rules. Simba did the same thing, and so do most young people. And the reason most young people do this is because it's evolutionary to your advantage to that. If you don't take risks and learn from them when you're 17 or 18, you will never learn how to actually deal with life when you're 30 years old. This is the time you take risks, and this is the time your brain learns from that experience of risk-taking, and therefore then you become a much more capable adult. However, if you take risks in a vulnerable situation, then you might actually also land up in harm. So the very advantage that this kind of developmental plasticity offers you when you're 18, 19, 20 can also put you at risk for harm. And that risk happens when, instead of a positive experience that lies for you in the world outside as you seek to explore it, there are whole bunches of negative experiences that you experience. Perhaps one of the most important is violence. And by violence, I don't just simply mean, having a nasty name called at you, although that can be very violent for some people, but I mean the more extreme forms like those 3 or 4 Kerala athletes. Being sexually harassed, for example, by older people, not necessarily old people like me, but older people within a peer group against whom you feel powerless. The use of unhealthy products, alcohol, now we know, and I'm not at all prohibitionist, so don't get me wrong, but I certainly will tell you this: the earlier you start drinking, and certainly before the age of 18, there are profound impacts on the brain structure, and that we now know can also lead to much higher risk for mental health problems as well as dependence. But it's the third and fourth I really want to focus on, because I think this is what really explains to a large extent the peculiar Indian story. And that is to do with the very rigid norms about gender, about sexuality in particular, and the worlds and the aspirations that young people have, especially those young people who feel that they've liberated themselves from these rigid norms through education. And the second thing is the aspirations that young people have through their education in terms of the kinds of jobs they will get, the six-figure salaries the newspapers tell them that they will earn, and the reality of the employment situation in India. But before I turn to two examples of these two particular kinds of factors in India, I just wanted to also tell you about another kind of thing that is affecting particularly older adolescents, and which is online pressures. And this is actually an article from the Guardian newspaper in Britain, talking about how there was a whole generation of young people who are feeling increasingly alienated from the world around them because of the sorts of pressures that online networks are putting on them. Pressures to do with, for example, the way they look, whether they have a boyfriend or a girlfriend, about whether they have enough friends of any kind, about a whole range of different personal attributes, and then people feeling miserable, getting low self-esteem because they don't feel they're as good as many of the other people in their social network. But I want to return to those two themes about education and about falling in love. In fact, I was thinking about calling my talk "To Die for Love," because a very large number of Indians are now killing themselves, not because they have lost hope in life, but they've lost hope in love. Because the love that they want is being denied to them. And I'll tell you, the most saddest story of all happened just 3-4 days ago. I'm sure many of you know what I'm talking about. One happened 2 days ago, which is to do with the educational issue. Just 2 days ago, when the CBSE results were released, and a Delhi boy who got 65% hung himself because his father scolded him because this was not a good enough mark to get into a college that would lead to a professional degree. This is an example of how we have reached a stage of competitiveness in urban India that even a pretty good mark could lead to such a terrible result because of the pressure on that young person to actually get into a professional degree. But perhaps this was the story that really, really affected me greatly when I read this, the story of Sonu and Sheelam, about 4 or 5 days ago now, where, I don't know how many of you remember this story. This was a couple that had fallen in love. One was Hindu, one was Muslim, another one of these terribly tragic stories that essentially ended with the two of them committing a joint suicide by burning themselves alive because neither family would allow them to actually have an open relationship. So it seems to me that really the key to understanding suicide amongst young people is this interaction between social adversity, such as violent experiences, and denial of our fundamental rights as individuals to exercise our sexuality, to exercise our choices in what careers we take, in a very rigid social environment. So Tamil Nadu comes to mind. In Tamil Nadu, Tamil parents are generally very, very proud that their young people are in university. Yet, when it comes to choosing your own life partner, it has to be within your religion, and worse, it has to be within your caste, and you have no say about that. And it is this kind of trap, the trap that you have been liberated at one end but denied the actual freedoms that come with it, which I believe actually interface with the impulsivity and the risk-taking behaviors that you see in young people leading to suicide. So I'm just going to finish off because there's not much time, and I'm going to finish off with a message of hope. We know how to deal with these problems. Other countries have done it. I don't have time to tell you detailed stories of other countries, except the one that we always compare ourselves with, which is China. 20 years ago, China had a suicide rate in young people, including in young women, that was 3 times higher than India. Today, it's half of India's rate. And of course, if you look at the story of China's success, emancipation of young women and men, the freedom to choose what you want to do, and the freedom to live and love who you want to live and love with, has been fundamental to the change in the well-being of young people's situation in China. How have they achieved that? First of all, and in India we're trying to as well, but we have a long distance to cover. First, at the level of the individual, building life skills. Many of you may have had that experience in school. Really the essential skills on how to deal with those developmental impulses, the impulsivity, the risk-taking, how to deal with those without landing up in harm. At home, to start working with parents to really begin to appreciate that, hey, if you want to educate your young people to dream, then you've got to let them actually live out those dreams. You can't suddenly build a wall and say these dreams are no longer permissible to you. In the community, I do believe that there's a role for mental health. I think many young people, before they end their lives, actually do seek help, but they don't know where to necessarily go. And I think improving access to mental health care, improving peer networks in institutions like this, so that people are aware of each other's mental health when it is impaired, and are able to reach out and simply provide a shoulder to lean on. In society, I think we need to work at a much higher level to promote far more progressive attitudes regarding sexuality, regarding gender, and regarding diversity of employment. We have to move away from the idea that our parents grew up, certainly my parents grew up with, which there were only 2 or 3 professions you could be, including one that you all are training to be, and everything else was rubbish. I think we have to create a much more modern, forward-looking society in which every profession is valued, so that young people can actually fit into whichever careers that they feel most comfortable to pursue. And finally, I think we also have to keep in mind that in a globalizing world, that there needs to be always a primary attention to the well-being of our youth, particularly in a country like India, where we have 300 million young people. That, for example, when we pass any policies to do with trade, that this does not in any way disadvantage our young people, for example, in terms of being able to access secure employment at decent wages. I think our policymakers should always keep our youth at the forefront of their thinking when they are deciding what policies to implement. So that's all I had to say, friends. It's a bit of a grim topic, but at least I hope that I ended with a slightly positive note, and I've got about 20 minutes, and I'm happy to take questions from you. So thank you.